In my experience, yes, okay, I was at that age, I was a teenage girl, but it wasn't about losing weight at all. I was a fit, healthy athlete. The last thing I want to do is lose weight. For me, it was just about restricting something I enjoyed, and I got pleasure in a strange way of denying myself things.
That was Amy Dingle, a peer support worker with local charity, Jersey Eating Disorders Support, and you're listening to the Bailiwick Podcast with me, David Conway. A recent government report has shown that eating disorders in young people have more than tripled in the last 4 years, with 44 cases as of April 2021, and no dedicated service specifically designed for children with the condition currently offered by government. It's not only children affected either, with Jersey Eating Disorders Support also reporting an increase in adults coming to seek help. The charity, which currently has 10 peer support workers, offers a range of services to those affected by eating disorders, as well as their friends and families, including group sessions and individual counselling. I sat down with Amy Dingle, both someone in recovery from an eating disorder herself and a peer support worker at the charity, to discuss her experience and what help there is for those living with the illness. Just before we start as well, a warning that there is some potentially distressing subject matter discussed in the episode. Amy Dingle, welcome to the Bailiwick Podcast. Would you be able to explain when you first experienced the first symptoms of an eating disorder and how that began to affect your everyday life?
I think I was around the age of 12. I was in my first year of secondary school. I seem to remember in year 7, everything was fine. I remember being just happy and just enjoying life, enjoying my sport, enjoying everything. And then I actually remember it's one day I was buying a flapjack from a vending machine, and one day I just didn't have time to finish it all, so I saved it for my lunch, thinking, oh yay, I can save up because I love food. And then I just didn't have enough time to eat it, and so I then had my lunch, and then slowly I kind of got the sense of happiness by restricting myself from eating at the time and putting off till later. So slowly that just built up, and I don't know, it just spiraled. And then I think when my brain sort of went into energy deficit, so I had lack of nutrition, I believe triggered my predisposition for an eating disorder, genetic predisposition, which then spiraled all of my behaviors and thoughts to around food, obsessing about food, exercise, and I slowly declined in my weight, in my personality, and then it affected all of my life. But it took quite a few years. So that was at the age of 12, and really it was only noticeable around the age of 17, where I was visibly as well as mentally ill.
And then once you finally did notice those symptoms, and once you finally did say that this was an issue, what support was there for you?
Initially, my mum took me to the doctor, and I saw a GP. However, I think I hope now that there's better awareness of eating disorders, but at that point there wasn't, and I was just told that, oh, it's just a phase, I'll get through it, I'll just eat more, like maybe go to McDonald's a bit more often. And I was sent away, and I think looking back now, I think maybe I felt like misunderstood, and it really spiraled my eating disorder at that point, and I really fell into a real downward spiral. So I think it then happened, my mum actually had to directly contact mental health services to get me some help. But it was quite a process, and it was quite hard for her to have to do that. And I managed to get an appointment eventually, and I did go through the system, but I didn't really get very far. But then it got to, I was 18 and I wanted to go to university, and there was no stopping me, even though I wasn't up very well. I'm a very determined person. And I said, oh no, I'll be fine. When I go to university, I'll be absolutely fine. So off I went to university. Oh, everything's fine. And it very rapidly decreased in health. And I ended up going to an eating disorders treatment centre. I was referred there from Loughborough University to Leicester Eating Disorders Service. And there, that was an experience, one I wouldn't wish on my enemy. But at the same time, I learned a lot. It was a big wake-up call to life. I'd been so used to being in my little bubble of Jersey, of really quite monocultural, to be honest. And then I was in the middle of Leicester with nurses that were of all different races and genders and ages, and it was really good for me, and it made me aware of what the world is. But it's not as cushy as Jersey, and if I cried, it didn't matter.
Would you be able to talk a little bit more about the treatment you received there?
Yeah, so it was a few years ago, and the place has closed down now, and gone to a different location because it had leaking roofs. But it was it saved my life. So don't get me wrong, it saved my life, and the staff there, they did all they could to help me and the really oversubscribed people there. So it entailed really just refeeding, to be honest. There was a level of psychotherapy, I suppose, but really it was just about meals, and it was a competitive environment. So there were some people that didn't want to get better, so they were on tubes to refeed them. There was people being restrained at times. You had one-to-one supervision to start with, and then you would go in a dorm with everyone, to your dorm to sleep, and then also in the dining room. And it was if somebody didn't finish their meal in a certain period of time, you would then all have to go and have a meeting about why they didn't finish, and it was all quite stressful. But again, they are different now, and I know there is help out there where they do different treatment methods, and they've worked with the patients a bit more, so it's a bit more individual care. It was just a bit more one size fits all when I was there.
And when you came out, how was recovery then?
So I wanted to leave as soon as possible, and I was there a while, but the beginning of the next year at uni, so I was able to postpone a year and then re-enter the year later. So I did that, but I really wasn't mentally or physically well yet. But I was still, as I always am, determined, no, I'm going back. There's no stopping me. So I went back, and yeah, the same thing happened. It didn't take long to just deteriorate again. And that time I did hit my lowest point of my life, to be honest. And I now understand when people feel like they've hit rock bottom, because that time I didn't want to go into hospital. I really didn't. I knew what the first time was, and I had to go in against my will. And that was, I was unexpected. It was done in a way that they told me not to tell. My parents were told beforehand, but they were told they could not tell me. So I went in with just a backpack on my back, with my books in from uni, just for my outpatient appointment. And then they basically said I couldn't leave. I was in the middle of England with no one I knew, not even a toothbrush with me. And I just had my hopes of university sort of ripped out of my hands. So, that was a hard time. But I made it through. So this is why I now work as a peer worker, and I know that when someone's hit rock bottom, it doesn't mean that's it. That you can get through it, even though at that point you feel absolutely hopeless. There's nothing that can ever make yourself feel better at that point. There is, and you just have to find someone to speak to, or just try and find some support somewhere, or just, even if you don't believe it, just have hope that it could get better.
For you, what misconceptions still prevail that you would like to see addressed?
I think there's still the stigma that it's all about teenage girls, like all looking in the media, oh, that person's skinny, let's look like them, and they just lose weight to look like a catwalk model. In my experience, yes, okay, I was at that age, I was a teenage girl, but it wasn't about losing weight at all. I was a fit, healthy athlete. The last thing I wanted to do was lose weight. For me, it was just about restricting something I enjoyed, and I got pleasure in a strange way of denying myself things. I don't know why. But yes, and also it isn't that age as well. There's so many people suffering at any age. There's actually been studies recently about pregnant women, and actually it can be the amount of stress over that can actually cause someone to kind of go into to unintentionally reduce their food maybe, and or if they're breastfeeding or something like that, it takes a lot of energy, and that can almost spur on an eating disorder, because if that person has the genetic predisposition for an eating disorder, anytime they go into that energy deficit, any like lower than what their energy needs, it can trigger something in their brain which spurs this eating disorder on. So it really can happen at any time of life, and at any point someone can get help, and it's not too late. If you've had it for 40, 50 years, that doesn't actually matter. You can still recover. I've seen it. I know a lot of people who've had eating disorders and are fully recovered. I believe are fully recovered, and they've had it their entire lives. Some of them don't even remember a time without it, but now they have moved on and they're living a full life.
And for you now, day to day, having lived with an eating disorder, can you talk about life now as a peer worker?
Yeah, so I am still in recovery. I'm not there yet. I stepped back from any help, formal help in mental health service a good while ago, actually before lockdown. And for me, it was the right thing for me to do because of where I'm at in it for myself. And I still speak with people who have recovered, and that's been the thing that's actually really pushing me on. So, because it's so inspiring when you speak to someone who is either going through it as well, and you can kind of, not feel alone. But also to see people like moving on and being positive about recovery is great. But yeah, as a peer worker now, I sometimes speak with people and just use my experience and just say that they're not alone, basically, and their thoughts, although they just seem crazy, sometimes you just can't describe what these thoughts sometimes to anyone. Anyone else that doesn't have an eating disorder wouldn't really get them. Like they can be so random, and there's a lot of people who are very intelligent, and then to get these like intrusive thoughts that seem so strange can be really confusing for a person. So I like to speak with people and say, look, it's okay, like, to be thinking these thoughts, but like I am, let's work to see how you can notice these thoughts, but it doesn't mean you have to act on them.
Would you be able to just give an example of one of those intrusive thoughts or an idea of what they entail?
Quite a lot about eating disorders sometimes comes with comparison. So I'll do one about like body weight, because it's a lot of people do have body dysmorphia and maybe that sort of thing. So someone might see someone as like, oh, that person's skinny. Oh, I better not have that piece of cake because I want to look like them. And so a person in recovery can see that as a thought. That's a thought, that I shouldn't have that piece of cake because that person's that. And then in recovery, you can think, well, okay, that's just a thought. By not eating this piece of cake, it doesn't mean I'm going to look like that. And why do I want to look that? What is the reason for that? Is it just about my body weight or my self-worth? It's not the same thing. Your physical body and your self-worth and who you are as a person, your identity, is not your weight. But there's lots of intrusive thoughts like, oh, I don't deserve this, and I don't deserve people's time. And it doesn't always have to be about the food. Often a person lacks like self-esteem.
You've obviously been through the system. You've seen the support. Do you think there could be more support on island for people with eating disorders?
I must admit, yes. I think I'm not too sure of who is in the island in the mental health service. There's only a few, it's a very small team. And I think they do the best they can, but it's just not enough to support the growing amount of people who are suffering with eating disorders. So I believe maybe a bit more specialized help that on the island, such as maybe a dietitian that has a therapeutic approach towards eating disorders, or a bigger team to help and support those over here. I mean, as a charity with the Jed's Eating Disorder Support Jeds, we have seen a huge increase in numbers recently, and it's great to see them now attending our group and getting that sense of community, and they're not alone fighting this, which has helped, I believe, quite a few, not just sufferers, but carers as well.
Amy's experience eventually led her mother, Karen Dingle, to become the chairperson of Jersey Eating Disorders Support Group, a role which she has now held since last year. The charity, which is now 37 years old, began with simple monthly meetings, but has since widened its remit to include a multitude of services, including weekly Zoom sessions across the pandemic. Sitting down with Karen, I asked her about some of the work the charity does and why she thinks there's been an increase on the island. Now, talking about eating disorders, there seems to be in Jersey a growth of cases in young people, certainly recently, according to the mental health strategy that's recently been released. It has tripled over the last 4 years in young people and is now at 44 cases. Would you be able to talk a bit about why you think this increase has occurred?
I think during the pandemic, we've all felt a little bit out of control. And with someone with an eating disorder, what happens is if they feel out of control, they put all their control into what they eat. So because that's something they can control. So I think that's what's made the problem so much worse, is that everybody's feeling a little bit out of control of what's going on. Some people overeat, some people undereat, but it amounts to the same thing. It's not being able to cope with the situation that they may be living in.
And I spoke to Amy about misconceptions and the fact that it's not just young people as well. It can happen to anyone at any age. And she mentioned you are seeing a increasing caseload yourselves. Could you talk a bit about the fact that it does affect adults as well?
Yes, absolutely. Eating disorders, people think that they're just for teenagers, but actually it can happen at any age, as young as 5 and 6, and right up until 70, 80s. It's men, women. It doesn't discriminate. It's anybody can get an eating disorder.
And in terms of support, obviously Jeds offer a certain amount of counselling from yourselves, but in terms of the island's mental health support, do you think there's currently enough provisions, or would you like to see more come into play?
I would like to see more people specialised in eating disorders. It is the most challenging mental health condition, and it just needs specialist help because it's a complicated illness and everybody's different. So it needs somebody who's got a really strong understanding of eating disorders to be able to help them.
And in terms of that help and assistance, would you be able to talk a bit about what it is to support someone with an eating disorder and help, what that entails?
As far as we're concerned, if a parent contacts me, if their son or daughter is under 18, I will always suggest that they go to the GP, and the GP will decide whether they need to be referred to CAMS, Child and Adolescent Mental Health Services, or if they're over 18, Adult Mental Health Services. If parent needs support, I can offer them counselling, or one of our peer support workers will see them and meet up with them. It may be that they would benefit from being in a group situation, and we have on the 1st and the 3rd Monday of every month, we're holding currently Zoom support sessions, and they may decide that they would like to benefit from the experience of other people who have been in a similar situation to them. So they will come along to a support group meeting. They don't have to show their face if they don't want to. They don't have to show their name if they don't want to. They can just come along and listen to what's going on. And what we usually find is that if somebody does come along and just listens, usually by the second or third time that they're there, they feel confident enough to speak. And then maybe later on, they're confident enough to put their camera on so they can be seen.
And in talking about eating disorders themselves and the root of them, I spoke to Amy again about the fact that they're often not what the public perception is of them, simply body dysmorphia. There are a number of other symptoms. Would you be able to explain a bit more about that?
Most teenage, particularly girls, go on a diet at some stage, and it's only those people who have a genetic predisposition to an eating disorder that will go on to have an eating disorder. It's almost like once you go into energy deficit, it's almost like a switch going off in your head, and it switches on the eating disorder. And this is why it's so important for somebody to refeed, to get back to a normal body weight, so that switch can go off again. And it's once that switch goes off, they can then go back to not having any issues, or very few compared to when they're in a full-blown eating disorder situation.
I recently saw, moving to more current events in the UK, that they're talking about bringing in this provision whereby large businesses will have calories put on food that they're serving on menus and things like that. I've just seen it's caused quite a bit of debate recently. And from your perspective, do you think that's a good preventative measure for healthy diets?
No, I don't think it's a good idea, because people with an eating disorder will focus on the numbers that come up, and it will put them off ordering something on a menu if the numbers are staring at them. They've got enough to deal with when they're trying to eat without having it, in their faces exactly what they're eating. I think what's more important is for regular eating, for people to learn to maybe eat and then have a gap of maybe 4 hours and then eat again, rather than some people constantly eat, and that can be a real problem. And I think during the pandemic, with people being at home, the fridge is close by, it's very tempting to just eat constantly. But I think rather than forcing people to look at calories, it's healthier to just try and help people to have regular meals and maybe regular exercise.
So what other preventative measures would you suggest going forward for the public to help getting at an early level with an eating disorder, to make sure people become aware of it sooner and then to know the steps to prevent it?
I think it's really important that somebody is diagnosed early, so it's not just left to see what happens, that somebody goes to get the help that they need as soon as possible, because what happens is the disordered behavior becomes a habit, and then once it becomes a habit, it is then very difficult to break. So what I, especially young girls, once or young boys, once they start to get into over-exercising, under-eating, they can lose weight extremely quickly, and those habits can become a part of their lives. And if they can get help early and that doesn't establish, then they're much more likely to recover and quickly.
So would you say then in future, especially in Jersey, perhaps more mental health service that specialises in eating disorders, do you think that would really help to get that as though early stage prevention in?
I think so. I think if there's a group of people who understand how important it is to to get the education into the young person as soon as they show signs, so that they know what they're doing to themselves, so that they can, before it goes down that slippery road. Prevention is better than cure.
Thank you to Amy and Karen Dingle for sharing their story and raising these issues, which Express will continue to be covering in the coming weeks. Thanks for listening to the Bailiwick Podcast. You can find all the past episodes under the Listen tab on our website, bailiwickexpress.com, and in all of the usual pod places. The music at the beginning and end of this podcast is I Shift My Weight by Luno. More next week.